Good evening, Ms. Chairperson. My name is Dr. Indra Selvarajah, and I'm a lecturer at the UPM Department of Music, Faculty of Human Ecology, and I am a music therapy lecturer, as well as a member of the World Federation of Music Therapy Council. And my presentation today is giving you a glimpse of the development of a music therapy-based screening tool assessment to detect symptoms of dementia, particularly mild cognitive impairment, embedded in artificial intelligence technology. So according to the 2021 report by the Alzheimer's Disease International, we estimate that 50 million people worldwide are currently living with dementia, with the number expecting to triple to 152 million by 2050. The cost of treating dementia globally is estimated at $1 billion and is expected to double by 2030. And while the World Health Organization reviews that 60% of people living with dementia are from low or middle income countries, as you can see from the chart, nearly 8.5% of the aged population in Malaysia suffer from dementia, with this rate expected to escalate to 15% by 2030. So the extent research shows that the majority of people at risk of contracting dementia are not detected due to various barriers to treatment. As you can see from this slide, 90% of dementia patients are expected to acquire behavioral psychological disturbances, and caregivers also frequently experience a range of barriers. Hence, conventional screening or assessment approaches to dementia are frequently met with common psychosocial barriers, including fear of testing, denial, social stigma, shame, ignorance, and misinterpretation of symptoms of signs as signs of normal aging. To bypass psychosocial stigma, current approaches to dementia treatment recommend the use of non-pharmacological methods such as music therapy. So this presentation details the ongoing development of a comprehensive integrated music therapy-based screening assessment tool that we are undertaking in UPM in collaboration with an AI specialist to detect MCI symptoms in the aged patients, as well as leverage on AI data capture and analytics to seamlessly connect with data sharing platforms for music therapists and the primary medical treatment teams to improve current options for dementia screening assessment. We are currently at the MVP stage, the minimum viable product, and have connected with the following organizations and institutions from both music therapy and dementia care management perspectives. We will start with research validation at the local level. You can see here that music therapy-based screening app is actually combining the MMSC, which is a very standard tool used for screening cognitive impairment, together with the MIDAS, which is a music in dementia assessment scale. It has been validated through several research studies overseas, as well as a couple of studies in Malaysia. And it has been shown to be effective in terms of being able to detect MCI symptoms using a music therapy-based platform. So the various research stakeholders that I mentioned constitute all these different organizations, but our research will be primarily focusing on Malaysia first. So to date, we have registered the interest of all those parties who would like to test the MVP, and for purposes of gathering more local research resources, we hope to encourage anyone who's watching this presentation to get in touch with us so that we can actually widen our outreach to local respondents. Please feel free to get in touch with me if you are interested. So what is music therapy and how does it help dementia patients? So music therapy is a scientific and evidence-based allied health field which is non-invasive, it is non-threatening, and it has proven effective with dementia patients at every stage of intervention, including preliminary screening for symptoms. Now, the symptoms that we often detect with dementia patients can run the gamut, not just in terms of mild cognitive impairment, but towards the moderate, of course, and severe stages. But what you will notice from my screen is that in music therapy, we create a safe space that is non-threatening and encourages patients to feel a lot more relaxed, less anxious. Music is usually considered fun and enjoyable and associated with entertainment and not so much testing. It's often also highly engaging. It's mentally stimulating. And the most important part is it helps to bypass all those psychosocial stigma issues and barriers that I mentioned earlier, which also means the social, relational, the supportive quality of music therapy interactions and the dignified approach that we use, because we emphasize very much preservation of personhood. It is something which will enable the patient to feel a lot more comfortable going through a music-based screening process. And that is what we are embedding into our AI solution. More importantly, it is all evidence-based. So the Cochrane Review 2018 has stated that music therapy is able to bring a range of positive benefits to dementia patients, and exploration of the use of music-based interventions to enable early detection of dementia symptoms at the onset stage is critical to arrest the rate of deterioration and initiate early intervention. So what you will see is in this particular site, there is actually an example of how where an Alzheimer's patient has already advanced in the stage of disease, there is sufficient research to show that even in severe cases, there are many, many regions in the brain that continue to be able to be stimulated by music and will respond to any form of musical interaction. So this means that even though we are primarily hoping to screen for any form or any signs of MCI at the early stage, even if cases come to us and they happen to be at a more moderate severe stage, we're still able to get them to participate at the very least to be able to register what is their level of cognitive impairment. So one of the things that I mentioned earlier was that the research tool that we are using as the basis for the music therapy-based screening is the MIDAS. And I'm just sharing with you a table that summarizes the different stages of validation that the MIDAS has gone through to be able to create this supportive musical environment for dementia patients. And we have found that dementia patients are able to respond on a variety of different parameters that will be salient for us to capture using not just the MIDAS itself, but also the MMSC to register any signs of cognitive impairment, cognitive delay, based on all the parameters of the MMSC which are known. So the MIDAS has already been validated in Malaysia using local healthcare workers working with dementia patients. We've also validated it with actual dementia patients and caregivers under UPM. And we found that it was something that was easy to apply. And even though it is rigorous in its quantitative approach, but the delivery and the practicality of using the MIDAS in conjunction with the MMSC in this particular integrated AI platform is something that we found caregivers and patients who are able to respond have actually given us a positive indication. So the tech-based solution that we are developing is meant to be user-friendly, accessible, and it's also something that we are delivering via a teletherapy platform, which means that it will be something that can be accessed from the home, and that will help to widen the outreach even to people who are in rural parts of Malaysia and in areas that they may not be able to access screening tools that are usually available. So with that, I thank you very much for your kind attention. This is an opportunity for me to share with you some of the developments that we are making in UPM using music therapy as a dementia-based screening tool integrated with an AI platform. Thank you so much for your kind attention.